this building was designed for patients to have hope, for patients to be able to move around, and they haven't had that since they've been here.
How's the staff morale?
Low. Rock bottom.
And how's patient morale?
Rock bottom.
Since 1988, Gary Hilton has spent most of his life at the Pueblo State Hospital. He was sent here after he was judged incompetent to stand trial for several violent crimes, including armed robbery, kidnapping, and assault. He has been in the high-security forensic unit since it opened.
I first met Sergio Taylor in 2006. They were always trying to find the right medication to help him out.
Hilton first contacted me after the death of Sergio Taylor, who in September of 2009 slid a plastic bag over his head and committed suicide in his room. Our investigation determined the staff found him with another plastic bag only minutes before his death, but didn't search his room or any place else in the unit. Nor did staff conduct a later required in-room check. Instead, a nurse simply looked through the window of his room to see him under the covers.
He was very scared. You know, he thought that his life was never going to get out of here.
And only a month before Taylor died, he and Gary Hilton signed a letter, along with other patients, to the director of the mental hospital.
It says, "We have been more or less locked in our individual units and a sense of hopelessness has set in." So what would you do all day?
You would just sit. You would just talk with other peers or stay in your room. He really didn't do anything.
And Hilton says that began a vicious cycle of patients acting out and the staff, spread thin by budget cuts, cracking down.
Then they take the person, they either have to put them in seclusion, the unit is tense.
Lots of yelling and screaming?
Yes, fighting.
Disruption.
Disruption.
And that, he says, sent everyone to their high security rooms again.
When patients are feeling bored, hopeless, and warehoused, assault and suicide attempts transpire.
Yes.
What did Sergio Taylor's death do in this unit?
It just crushed the morale. People were crying, they were very upset.
Among those most disturbed was another mutual friend, Edward Benji.
He said that this place killed him. He said that how could these people not give him hope? And he became very depressed.
It was after Taylor's death that Edward Benji first contacted me, initially by phone and then with this letter, referencing dangerous conditions at the state hospital in Pueblo. Staff are keeping patients locked on these wings with absolutely no staff supervision, he wrote. They are knowingly placing patients directly into dangerous conditions. He concludes, they absolutely don't know how to run this new facility, and it's not because we don't have enough staff, it's because the staff we already have are incompetent.
He fought for a lot of patient rights while he's been here.
And that seemed to keep Edward Benji going until August of this year.
When Troy Geske was put in restraint and died in restraint, what did it do to Ed Benji?
It angered him. It deeply depressed him. He felt at that point that for himself that there was no way out of here.
Benji again went into an emotional dive.
Ed gave away his music and started to give his personal possessions away.
Mark Ivandick is managing attorney for the Legal Center for People with Disabilities and Older People.
Someone on the staff should have recognized and said, this is out of the ordinary.
His is an advocacy organization appointed by the state to oversee federal requirements for the mentally ill. He corresponded with Edward Benji for years and says the death of Troy Geske finally broke Benji's will to live.
It led to feelings of despair, hopelessness.
On September 20th, Edward Benji stuffed his door lock with paper and hanged himself from a bedsheet in his room. Our investigation has found the staff spent more than 10 minutes trying to break the lock with an oxygen tank because they didn't know how to use a specialized tool nearby to open the door.
If they could have gotten to him earlier, maybe CPR would have saved him.
The tool was available.
Yes, it was.
After our investigation made staff errors public, State Human Services Director Karen Bai agreed to speak with us.
The procedure would have been to use the door opener, and that didn't happen quickly enough.
But they didn't use it.
That's correct.
She admits that the staff was poorly trained and simply didn't know what to do.
It should come as second nature. And I think when you don't practice that over and over again, and you're scared, and you know that there's an emergency, and you're afraid of what you're going to find, people forget.
This is just another example of a consistent lack of training and execution of stated policies and procedures that we have uncovered, a contributing factor in the deaths of Sergio Taylor, Troy Geske, and Edward Benji. After each death, the staff has been retrained on specific procedures. Yet we have found that not one person has been fired. Sadly, on the day Ed Benji committed suicide, I received this letter from him. It's dated September 7th. He sent along newspaper clippings of Troy Geski's death and claimed the hospital staff had murdered him. Meanwhile, our investigation has prompted an independent third-party review of the forensic unit at Pueblo State Hospital, and now a grand jury has been convened to investigate the deaths that have been the subject of our reports. Coming up, you're going to hear from the prosecutor who wants to know if these fatal errors add up to a crime.
Anybody in our families can be a patient at the state hospital. They're human beings and they deserve the care and the treatment that is required for their mental health, stability, and improvement.
Former state legislator Bill Tebow is the Pueblo County District Attorney. After monitoring the results of our 2-year investigation of Pueblo State Hospital, he has now opened a grand jury investigation.
It really was precipitated because of the recent deaths that have occurred, and in part because of issues that you've brought forward as well through your investigative reporting. You seem to kind of wrap everything up in a package well enough for us to say, hey, we've got to look into this. What is going on out there?
So far, we have confirmed that guards and family members have been subpoenaed.
This is a very thorough investigation to find out what's wrong and who's responsible, and does that rise to the level of some criminal culpability.
Criminal negligence.
Yes.
Public scrutiny, I think, has helped us look at where do we have voids, where divisions have functioned independently and one hand doesn't know what the other hand is doing.
Our investigation also prompted State Department of Human Services Director Karen Bai to order an independent third-party review of the forensic unit where Sergio Taylor, Troy Geski, and Edward Benji died.
We need to find out why this is happening, what we can do about it, and how we're going to fix it.
And given the scathing report now made public, there is plenty to fix. Among the findings, the overall environment in the forensic unit is stark. It evokes an atmosphere of despair, increasing the risk of suicide, agitation, and the need for emergency and involuntary interventions. Most patients stay in their residential pods most of the time. This kind of restriction is counterproductive to clinical progress. Prone restraint and seclusion were used as a primary patient management approach.
If they don't make changes, they're going to have another suicide.
Ironically, the outside expert report mirrors many of the same issues Gary Hilton, Sergio Taylor, and Edward Benji pointed out in their letters more than a year ago. And Hilton claims the findings in the report that he has not seen have now produced paranoia in the staff and a new crackdown on patients.
They have taken more privileges away from the patients, where you cannot have your MP3 players any longer down into your room and listen to music. And these protocols are nothing but restricting patients. It has nothing to do about treatment. It has nothing to do about patient care. It's all about, we don't want to be in the papers again over another suicide. We cannot afford another suicide.
Our investigation has shown lack of supervision, failure to follow practices and procedures that were already in place, lack of training. They resulted in deaths and injuries. What have you been doing up to now to address that?
Up to now, we've been making sure that we provide training. I think what we have not done well is making sure that people aren't just trained, but that they integrate that training and that they exhibit the competencies that are required of them.
The State Department of Human Services has so far responded to the critical report by beginning an intense training program for staff, eliminating prone restraint in all CDHS-controlled or regulated facilities statewide, forming a suicide risk mitigation committee, and modifying patient locks and doors for easier access.
And there are going to be times when we make mistakes, and we have to say, we have made a mistake, and we are going to fix it, and we're going to fix it, and make sure that it's done right.
That is little consolation for families in search of justice.
This just strengthens my belief that they killed my son. I want somebody to pay for the death of my son.
The outside review noted that the forensic unit is understaffed by as much as 20%, and any meaningful change, well, it's going to cost money. Money that has to come from the cash-strapped state budget. The question is, will the legislature consider the safety of both patients and staff at the Mental Health Institute at Pueblo a high priority? Our investigation continues. I'm John Ferrugia. Thanks for joining us.